The first item is in the name of Deputy Robert Troy. This is the vacant position of Director of the HSE's National Office for Suicide Prevention. The Deputy has 4 minutes.
Thank you, Chairperson, and indeed can I thank the Cairn for selecting this important issue, and indeed for the Minister for coming in to hear what I have to say and give her opinion on it. I think the lack of priority being afforded to the filling of this post is indicative of the priority this government has given the most serious issue of suicide prevention and mental health. In the past 12 months alone, we've seen the departure of 2 directors from this office. Jeff Day quit the post, expressing concern about the lack of resources and staffing, which is 7 million this year. And Dr. Susan O'Keefe, appointed to the role in June, lasted just 3 months, when effectively the Department of Health poached her. The HSE said the appointment would be filled by October, but the acting director, Martin Rogan, said it would be more likely to be mid-November. Once again, we see that it's going to be filled by an internal process, and I ask the question, can we have confidence that this process will ensure we get the best candidate, and can we have confidence that we won't have a repeat of what happened before and the Department of Health will not seek to poach the new director? It is regrettable that in the past period of 1 year we've had 3 different directors and periods where we've had none, thus showing a lack of leadership and a lack of direction in this critical office. In fact, Noel Smith, founder of suicide charity The 3 T's, said the vacuum at the head of the National Office of Suicide Prevention was quite telling of the government's attitude to suicide. This is at a time, unfortunately, when the number of people dying through suicide is rising. We're the 4th highest suicide rate between 14 to 24-year-olds in the EU, the 3rd highest among young men 15 to 19, and the preliminary figures show that 525 people died last year. I'm conscious in my contribution that just this week a leading psychologist, Dr. Tony Bates, suggested that the intense focus in society on suicide is conditioning some people into thinking that it's a viable option in their lives. He talks about focusing on strengthening the mental health of young people rather than emphasising the issue of suicide. Minister, I want you to confirm that you do have devolved responsibility from the Senior Minister in relation to mental health, and to ask why the 35 million, which was redirected from the mental health budget to community mental health, remains largely unspent. In fact, if this remains unspent, the cut to mental health will actually be 8% this year and not the 1%. Now, I do understand that recruitment for positions is ongoing, but no one will be held or no one will be appointed prior to December the 10th of this year. Therefore, no money will be spent of that €35 million. Again, to me, this signals the government's commitment to mental health, that after 1 full year of promising to spend 35 million in the area of community mental health, it remains unspent. Can I ask, Minister, can you confirm when the post of the Director of the National Office of Suicide Prevention will be filled? Are you confident that there will be adequate resources will be in place to ensure the new Director will be able to do his or her job? Are you happy that the internal recruitment will deliver the best person for the job and that there won't be a repeat of the Department of Health poaching the person? And in relation to the €35 million of the mental health budget, will any of this budget be spent this year? If so, how much? And will any of this budget be used to plug the large deficits in the general health budget? And can you, as Minister with responsibility to mental health, give a clear commitment on the floor of the Dáil today that the government's commitment for €35 in the provision of community mental health per annum will be honoured going into the future? And I bring this up because I have a very, very deep interest in this. I was a founder member of the North West Meath Suicide Prevention Group a number of years ago back home, and I'm a member of the cross-party Oireachtas Committee here in relation to mental health. I know you have a deep commitment to this area, Minister, and I hope that you will be able to alleviate some of the concerns and some of the fears that I am after raising here today.
Okay, Minister, 4 minutes.
Thank you, Cathaoirleach. I wish to thank the Deputy for raising the issue. You know, it's a subject that I never tire of talking about, or I have a deep interest in, and I'm glad to see that the Deputy has as well. The National Office for Suicide Prevention was established by the HSE in 2005 to implement Reach Out, our national strategy for action on suicide prevention. I'm very much aware that the National Office plays a key role in developing and supporting initiatives related to suicide prevention. Since the launch of Reach Out and the establishment of the National Office, there has been a significant amount of cross-sectoral working, which has resulted in considerable advances in suicide prevention initiatives, including the Assist and Safe Talk training programmes, the Tough Economic Times programmes, mental health awareness campaigns, supporting voluntary organisations in their work on suicide prevention, the piloting of a scheme of suicide crisis assessment nurses working with emergency departments and GPs, which will be rolled out nationally this year. And in your supplementary, Deputy, I can explain that if needs be. The first director of the National Office retired in September 2011, and the position was immediately filled on an acting basis pending the running of an internal competition for the permanent post. The new appointee that was selected from the competition took up the post in June, and I think everyone was of the opinion that not alone was the acting director an excellent person, but indeed the person appointed was equally eminently qualified. Unfortunately for the office, that person was very soon after selected to play a key role on a new national project and was seconded to the Department of Health in that context on the 10th of September. Since that date, the Assistant National Director for Mental Health, Mr. Martin Rogan, assumed responsibility for the Director's duties. The post has never been vacant. During this time, the Office has continued to function very effectively. It hosts its major National Suicide Prevention Forum at the Royal Hospital in Kilmainham, September the 10th, with over 100 participants from the statutory and voluntary sectors. It has also published a detailed annual report for 2011, which was laid before the Houses of the Oireachtas just last week. On 27 September, expressions of interest were again sought from general manager level grades and above within the HSE for the permanent post of Director of NOSP. The closing date for receipt of applications is the 10th of October. The interview process will be held on the 22nd of October. I would like to make it clear that mental health and in particular suicide prevention are priorities for the government. In this regard, a special allocation, as the Deputy will know, of 35 million for mental health was announced in Budget 2012 in line with the programme for government commitments. Funding from this special allocation will be used primarily to further strengthen community mental health teams both in adult and children, and to initiate the provision of psychological and counselling services in primary care, specifically for people with mental health problems. From this allocation, an additional 3 million has been made available to the National Office to implement prioritised suicide prevention initiatives, including GP training in suicide prevention, still further improving access to services for those who self-harm, interconnecting existing suicide prevention helplines, and expanding the National Mental Health Awareness Media Campaign to target men aged 35 and over. And as I say, if the Deputy wants to ask me additional questions, I have no difficulty in answering those.
Two further minutes.
Thank you, Chairperson. Minister, you've outlined the time frame, and I welcome the fact that that interviews are going to be held. I'd ask you to maybe just to answer a couple of the points that I raised specifically in terms of your confidence that the best candidate will be got in terms of an internal process, and that there will be no further changes, because while there has been someone either acting or in the position for the last 12 months, there certainly has been a lack of consistency. And chopping and changing someone at the top of any organisation isn't good. And no one is casting doubts or aspersions over the ability of Mr. Martin Rogan, but it does remain a fact that we have had a lack of consistency over the last 12 months in what, to me, is an extremely important national office. And could I ask you to clarify also in relation to one of the reasons a previous director, Mr. Jeff Day, quit, and he cited concerns in relation to the lack of resources. So are you confident that there will be adequate resources for whoever the successful candidate will be, that they will have the adequate resources to ensure that this office does its job and does its job well, because this is a serious problem in our country today? And in relation to the 35 million that you've spoken about, can you give a commitment, or can you update the House today how much of that money has been spent? How much of that money has been spent? How many additional people have been hired to as you said, in relation to further strengthen community mental health teams in both adults and children's mental health services, and initiate the provision of psychological and counselling services in primary care? How many additional people have been hired? And I made a very valid point in relation to December the 10th. Is that true? Are people being recruited now pending starting on December the 10th? And will the 35 million that hasn't been spent this year, will that be carried forward next year? And will the 35 million that's meant to be spent in 2013 be spent also? So 70 million next year.
Could I just, Deputy, I hope I remember your questions because I can't seem to find my pen. In relation to whether or not the internal process will give us the best candidate, I can only judge on the history of the people we've recruited in the past. And it is my experience, and the advice I have is that the candidates recruited, both the first director and indeed the second director, were excellent candidates and eminently suitable. So I must assume that during the same process that we're going to get someone that's suitable as well. Deputy, it is pointless giving me 35 million if I cannot recruit. It's my opinion. I cannot recruit. Getting a breach in the embargo was far more important than the 35 million. And I can guarantee you now that the 414 additional posts, which is the key piece here, the 414 additional posts will be in place this year, will be in place. They are being recruited as we speak. Now, you know that that type of recruitment, whether it's someone from abroad, there has to be checks, both with the Gardaí and the professional credentials. All of those things have to be taken into account, and that is vitally important. That is vitally important. Those posts will give us not just a fully fleshed out community mental health teams and a psychological service, but a robust service as well. Now, that's what's important to me. That's what's important to me. December the 10th. December the 10th. And it should have been earlier. It should have been earlier. But unfortunately, because of the checks and balances that had to occur, that's when it's now going to be. Do I think that instability in any office as vital as the Office for Suicide Prevention is not a good thing? Of course I believe that. And I'm very hopeful, and I have asked the National Office that when they're advertising and when the recruitment process starts, that it would be pared back to the very bone to ensure that it happens quickly, because these things can sometimes drag on. But
Minister, just to let you know your
beg your
time's
pardon,
over,
Chair.
John.
But what I am saying to you is that I'm hoping that the new director will bring with them, man or woman, will bring with them the type of stability that we will need in the office.